need a spinal needle, 3.5 inches, usually 22 gauge is what we'll be using. And usually we would fill the syringe, a 10 cc syringe, with 5 cc's of 1% lidocaine, another 4 to 5 cc's of 0.5% bupivacaine. Again, that provides a mix of both kind of short-acting and long-acting anesthesia. And then 1 cc of triamcinolone, so 40 milligrams of triamcinolone to provide an anti-inflammatory effect as well. So in order to identify the sciatic nerve for this nerve block, you're really trying to identify the quadratus femoris muscle, which attaches between the greater trochanter and the ischial tuberosity. It's an external rotator of the hip, and so you can identify that muscle by both internally and externally rotating the hip while trying to visualize under ultrasound, and you'll be able to see the muscle kind of gliding back and forth as you're doing so. Here is a good view of both that muscle and the sciatic nerve. The sciatic nerve is the hyperechoic ovoid structure right on top of the muscle, classically described as a honeycomb appearance or a cluster of grapes. And you can kind of see it coming in and out of view as I'm rotating the hip back and forth like this. So that's really a good way to identify both the muscle and the overlying sciatic nerve. So once you have that in view, you can then kind of proceed with the nerve block. You'll be doing a in-plane approach, meaning the ultrasound is kind of axial to the patient, and you'll be inserting the needle long axis along the axis of the ultrasound probe. It's important when you're doing these type of nerve blocks, because the needle is long and thin, you want to make sure that you get the right trajectory kind of from the get-go, because otherwise it's going to be hard to redirect the needle once you're in the skin. So as I'm going to scan back and forth, see if I get a good visualization of the needle here. You can kind of see, because these needles are so thin, it can be a little bit difficult sometimes to see the needle, but you can kind of see the trajectory of it kind of going in and out there toward our target structure. Sometimes you can inject a little bit of fluid to kind of visualize kind of where the tip of the needle is. And you can kind of see right here that I'm starting to bathe the sciatic nerve with some fluid surrounding it. And once you've fully kind of bathed the sciatic nerve, kind of top, bottom, kind of left and right, that's how you know you'll have a kind of adequate nerve block there to provide the block that you need.